Good morning, everyone, and welcome. I'm John Horowitch, President and CEO of Easterseals, DC, Maryland, and Virginia, and I'm honored to welcome you to our second Candid Conversations webinar. We're thrilled to be able to leverage our core value of innovation to bring you regular sessions on topics of interest, like our last one on talking to your children about racism, and today's on balancing self-care, career, and childcare during the pandemic. Please be sure to follow Easterseals DC, Maryland, and Virginia on social media so that you see our upcoming webinars, or join our mailing list by emailing info@eseal.org. At Easterseals, our vision is to create a hopeful, inclusive community where all individuals realize their potential and live meaningful lives. And we bring that to life every day through a broad variety of programs, including employment, child development, including Head Start, respite, training, adult day services, therapy, and most relevant for today's call, mental health care. Access to high-quality, evidence-based mental health care is key to creating a hopeful, inclusive community. Did you know that according to the National Council for Behavioral Health, about half of all individuals in the US will experience a mental illness during their lifetime, and that the US Census Bureau reports that even before COVID-19, 1/3 of Americans exhibit signs of clinical depression and anxiety? Unfortunately, even before the pandemic, the National Alliance on Mental Illness reports that less than half of adults with mental illness get care. And the problems are only increasing with COVID-19. According to a study by the Kaiser Foundation, about 50% of Americans report that the pandemic is harming their mental health. Furthermore, July is Minority Mental Health Awareness Month, and the treatment rates for mental health issues for minorities are even lower. For Asian Americans, the treatment rate is half the rate for whites, and for Black Americans, it is only 65% of the rate for whites. That's why at Easterseals, we're focused on expanding accessibility of mental health care. If you'd like to get involved in this critical cause, please email info@eseal.org. I'm so pleased to have this incredible panel of experts with us today to share their wisdom on steps you can take to balance the stresses of self-care, career, and childcare during the pandemic. Our panelists include Dr. Millard D. Collins, who is the interim chair and associate professor of family and community medicine and associate dean for student affairs at Meharry Medical College. He graduated from Xavier University with a BS in chemistry and received his MD from Meharry Medical College. He's also completed mini fellowship in geriatrics at UCLA and is a Harvard Macy Scholar. He's on the front lines of treating patients with COVID-19. Brandon Luckett is EVP of EONE Benefit Solutions. Brandon has more than 12 years of health and welfare consulting expertise and over 16 years in the corporate insurance industry. He holds both a BBA and an MBA from Loyola University of Maryland and a certificate in executive leadership from Cornell. Dr. Tracy Neal-Walden is a senior vice president of Easterseals, DC, Maryland, and Virginia, and the director of the Stephen A. Cohen Military Family Clinic at Easterseals. Dr. Neal-Walden is a licensed clinical psychologist and a retired Air Force colonel with more than 25 years of experience in mental health treatment, leadership, outreach, and policy. She holds a PhD in clinical psychology from Drexel University Hahnemann Medical Campus in Philadelphia, and completed a 2-year postdoctoral fellowship in clinical health psychology at Wilford Hall Medical and Surgical Center in San Antonio, Texas. She serves on the American Psychological Association's Continuing Education Committee and has conducted and published research in the area of suicide prevention. Megan Scully is senior editor at CQ Roll Call and also the mom of 3 children, including her sons Elliot and Danny, who attend Easterseals Harry and Jeanette Weinberg Child Development Center for early education. Danny has lissencephaly and also receives therapy services there during normal times, though they're now provided remotely. Megan holds a bachelor's in journalism from American University. Now I'm pleased to turn the program over to our moderator, Darnell Burtin. Darnell serves as Vice President of Development at Easterseals, DC, Maryland, and Virginia. And as he is the father of three, we hope he will ask many of the questions the audience wants to have addressed. But you can also feel free to ask questions in the Q&A box. Darnell?
Good afternoon. Welcome to Technology 2020. First of all, thank you guys for joining us. For those of you who joined the conversation, moreover, thank you so much for our esteemed panelists. Your degrees read like the who's who and the where's where of the colleges and universities. I'd like to start this off by first giving you guys a high level of what the conversation looks like today. So we're going to have introduce each panelist again, give them 3 to 5 minutes to talk about who they are and kind of the lane they're going to play on this call. In addition to asking them a question. And then after we get through each of the panelists, we're going to spend some time hopefully discussing as a group. The one thing that's really important that helps us really move this conversation along is for those of you that are logged on and watching this here, please, please, please send us questions. We have a team on the backside ready to answer, and even some of those questions will be answered by our panelists. So again, thank you guys for joining today. This is a really, really important topic: mental health, community and health disparities, and parenting, and even the corporate side. We're trying to give you all those views. It is duly noted that this is being recorded and will be shared afterwards. So for those of you that are logged on, you can share additionally afterwards. And even our panelists, you can share this with your friends and family and some of your coworkers afterwards. We'd love to start today with Megan. Megan, please unmute yourself just so you don't do like Darnell did and be talking to the screen. Megan, first question. How are you? No, I'm joking. First question. We would love for you to reintroduce yourself, give a little bit of history about yourself. But as a parent, specifically during this COVID timeframe, how are you feeling? And what has been your, not necessarily sense of urgency, but what have you been feeling about, sending your kids back to school? How COVID has really impacted your home? And again, are you taking time for yourself personally to have the aha moments and breathe?
Yeah, I think is important. So as they mentioned, I have 3 young sons who are 8, 4, and 2, and a full-time job as a journalist in Washington. My husband also works full-time. We are very fortunate that he and I can both work from home. But it's a juggle every day, and finding time to do our work as a journalist. My work is often very time sensitive, so there's not, it can't wait till the kids go down for a nap or until after lunchtime. So trying to strike that balance between my husband and I, and also just making sure the kids are healthy, are happy. They've been struggling too, emotionally and mentally with this, especially our oldest son, who is 8. We are starting to have conversations about what to do for the school year. I think that our outlook on that is evolving very quickly and changing almost from a day-to-day basis as we hear more about increased COVID rates in other places, and how that could impact us in 4 to 6 weeks when the kids will actually be going to school. So we live in DC, so we're awaiting news on what DC is specifically going to do. I think one aspect, our middle son, Danny, is medically complex. One gift that we have, I think, as parents of a child with special needs is, I'm a control freak by nature, but when you have a child with such medical complexities and medical fragilities, you realize you can't control everything. And I've learned through Danny to kind of let go, and to allow what happens to happen. I'm trying not to stress too much about what the school year is going to look like, because I don't know what options we have yet. So until we get there, you know, we're trying to get as much information as we can to make informed decisions. But I'm not letting it keep me up at night. And I think I have Danny and our life as a family with somebody with such special needs to thank for that. We've long since abandoned the ability to plan far in advance. So.
Okay, well, I'm gonna pause you just so I can make sure I get everybody, but we're gonna come back to that because I really love for all the panelists to discuss how that dynamic of the children, work, family, stress is playing into how you all feel, both from our medical professionals and then our parents and your corporate careers. Tracy, being the person who has the background in mental health here, first, thank you so much for joining us, and your skill set and your history and your work experience speaks volumes for who you are before anyone ever has to say hello. But moreover, one big question. You work with veterans, and what is that population feeling right now? And in answering that question, can you talk a little bit about how that population may be feeling in conjunction with just folks, those of us who haven't been veterans and other? Is there a difference you're seeing in how that's being handled in the mental health as far as COVID is concerned?
Well, it's important to mention that veteran population, they're a subset of society. And so many Absolutely. Of the things that they're experiencing are similar to what general society is experiencing, but then there may be some different nuances, especially with some of our clients who are wounded warriors. And so they may have additional medical needs, as you know, as Megan alluded to as well. With those medical needs, then they need to continue their medical care. And so that can be pretty anxiety provoking for individuals in terms of how do you continue to receive that care? What care do you continue at this time, and what things are you able to, you know, put off or receive care remotely? And so for us, the week of March 16th, our clinic went full remote telehealth. We were already doing telehealth. We had implemented telehealth in our clinic in 2018, and at that time, about a third of our clients were utilizing telehealth, and that was partly because of the geographical region that we live in, and traffic can be so difficult. However, once we moved to 100% telehealth, we had a subset of about 10% of our clients who chose to not continue in care initially, because at first they thought that this was just going to be, you know, a month or so, and that it would all end and life would go back to normal. But as we're realizing that we may have a new normal, our clients who initially chose not to do telehealth are re-engaging. And we've been engaging with them throughout, even those who did not want to do telehealth because they weren't familiar with the technology. We followed up with them, and now the majority of those are engaged in telehealth.
Tracy, quick question. Are you seeing the numbers go up, or are they leveling off?
Oh, absolutely going up. And part of that is, well, there's increased anxiety, there's increased depression. Folks have additional needs because they may have lost a job, or because they have other medical needs, or maybe high risk. They don't want to venture out often. And so we've partnered with local agencies to help provide food to some of our clients as well. And we have a team at Easterseals, including folks from the clinic and the other programs, who go out to provide that food for our clients who have that additional insecurity or vulnerability. And folks, it really varies in terms of the needs that you know, folks are experiencing. And so it's really important for us in the clinic to assess all of those needs to see what the true needs of our population are. But it's also important for us to take a step back and take care of ourselves. And one of the things that's really important for us to keep in mind is that we're all experiencing some of the same, the same anxiety that our clients are experiencing in terms of, not knowing what's going to happen, not knowing what's going to happen in the future regarding school, or even how long we'll be able to continue to telework. I mean, for some people that is a struggle or a concern, or just even, for those folks who do have to work, how do they deal with the anxiety of not bringing home the illness to their families? And so those are all of the things that we're dealing with our clients. And it really is a challenge because we feel what they're experiencing as well.
I said, I'm sorry, I'm muting myself as well so I can participate as an active participant listener. That's a skill set my wife says I need to learn more, is the listening piece, right? So working on that today. Brandon, your lane is a little different. You work on the healthcare benefit side of this. And before we talk about the personal side, I'd love to understand a bit more of what you guys are seeing from the corporate side of the fence and the benefit side. What is your industry feeling? How are you guys managing the stress of what's going on your side, number one? And number two, are you seeing an ebb and flow in business? What's happening on your side of the shop?
Yeah, so I work for a company called EONE. I represent the business side of the conversation here today. Personally, I'm married, 3 kids. My wife is a part-time school teacher. And so I'm very fortunate that she's able to work from home and do that. And there's a balance there. But I also, just a point of note for me, I come from a lot of these perspectives from a perspective of faith. So that's an important part of who I am as a person from a baseline. But to answer your question, we are considered non-essential. So fortunately, we were able to work from home. Business remained pretty much as usual. We could do things remotely. We had to really man up on the technology front and learn how to use Zoom and Teams, et cetera, very quickly to be able to service our clients. But fortunately, business was really not impacted as far as our clients. New business, which is my focus, was. I mean, a lot of companies changed. A lot of people became unavailable. It's hard to get connected with people. But from a pure consulting perspective, which is what we do, we're a consulting or a benefits consultant and a service provider to employers, we were able to continue to service our clients. So I think that was the bulk of your question. So I'll turn it back. Yeah.
Absolutely. At this moment, we have a poll, and I'm on our backside. I'm not sure if the poll has been shared, but if it hasn't, let's share the poll so that we can get some poll results. We'd love for you guys. Here's the poll. It just pops up. So please answer those questions. We're going to use that as part of our conversation here in a little bit. And please, again, feel free. This is meant to be ebb and flow. Please feel free to send us your questions. We have folks on the backside willing and waiting to answer some of your questions, and even some of the panelists. Dr. Collins, Dr. Millard Collins, yours is a little different lane. You're on the front lines of COVID, and you're in a predominant, you're working, first of all, you work at Meharry Medical, which is a historically Black college and university. But on a second level, the community that you're serving is probably, I would think, more African-American, and you're seeing a lot of the effects of COVID, both on a level of those infectious levels, but even on a stress level. Can you talk about it from both of those places? One, how you're feeling affecting and working in the community that you work with, but two, what are you seeing from the folks that you're serving? How are they feeling? How are they, what are they saying to you when they come to get tested and when they find out that the yay or nay is the answer to that result?
Thank you for your question, Darnell, and it's good to be here today. As a devoted husband and a father, I get to be that at home, but as you allude to it, out in the community on the front lines, they come to us for answers, even when we have none. This is a pandemic where everything changes. The recommendations, the guidelines, they change almost daily. So when they come to us for clarity. They come to us for support, even though they know we don't have the answers. As you mentioned, at Meharry Medical College, where we've been here since 1876, primarily devoted to serving the underserved communities. This is more or less the same of what we've always seen. So when they come to us, and we've been having a very visible platform. Our president, Dr. James E.K. Hildred, actually serves as part of the COVID-19 strategic planning folks for the city. And he's always giving a daily word. And he's taught us a lot about what it means to be a vector and what it means to carry this disease. And what I'm seeing and what everyone is hearing, to your point, is that this disease, while it's novel in its own strain, we have found out that those that suffer from chronic diseases and morbidities are at increased risk of death. And those, unfortunately, have been those in the African-American communities, in addition to other vulnerables and those that have pre-existing conditions. So when they come to us, they want to know what can they do. Fortunately, all we're offering them at this moment is, some testing. I go back and forth on the testing because, there's nothing therapeutic about a test. And we know that the best advice for any disease is prevention. And the only way to prevent this is to stay home, but it's very difficult to do. About 4 weeks ago, I believe the narrative nationwide has shifted to, we're going to go into this reintroducing everyone back into the normal way of life. And as we've seen recently, it's been, in my humble opinion, an abysmal failure. What I think we heard was, especially the people of color, is, hey, you need to get back to work because everyone else is going back to work. But many of them come to us and says, well, aren't I vulnerable? I liken this to cancer screenings. Many cancer screenings are for general population, but you have some that have increased risk. Most African-American males will get prostate cancer, 1 in 8. So they are different. And I tell them the same thing about this COVID-19. So we try to reassure them that they're not alone, that even if they don't have the symptoms, if they are positive for COVID-19, that they can carry to someone who may not receive it well. So we take every opportunity to try to educate them about what this pandemic is really all about, how to do self-care, but also how to protect those that may be vulnerable that they come in contact with.
Thank you, Dr. Collins. I appreciate that. Again, first of all, second of all, I really, really appreciate this dialogue. This is a tough conversation. On our last conversation, we had a number of folks pushing, saying, hey, we want to discuss mental health. We want to discuss some of the stresses. I'm feeling stressed out. Do I go to work? Do I not go to work? Do I send my kids to school? Do I not send my kids to school? I can't work at home. My kids are running across my screen, right, Megan? And so how do we manage those things? And so, first of all, if you guys haven't answered the poll question, please answer the poll question. I'd love to share those results with you after I ask this question to the group. We're going to be ready to transition into the second part of our speaking, which is, this is more for everybody. So I'm going to toss out a question, and please, as you guys on the panel, feel free to engage. This is the first personal question. For those of you with with kids of school age, what are you feeling about the upcoming school year? Are you thinking you're going to send your kids back to school? And I'd love for you to talk to this from the point of view as one, as a parent, but two, where you are on this call. How are you guys feeling about the impending school year and what your jurisdictions are saying about sending your children back to school?
So I'll start. I made the decision last night to not send my son back to school in the fall. He's a rising 8th grader, and we had until, I believe, tomorrow to make the decision, but I decided last night to enroll him in online school for the fall semester. It was a difficult decision because I feel like he, as well as other kids, they really need that socialization and they need the routine. However, the option that the state in which I live, in the county in which I live, was offering, I just didn't feel like it would be safe enough for my family. And I felt like it actually would be a more chaotic routine with him going in 2 days per week, and then asynchronous learning the other days. And at least if he does online all days, it will be synchronous learning. So he will have that opportunity to at least connect to people via, Zoom or whatever platform that they use. But it's also going to take a lot of additional work from us. And so in making that decision, I spoke to him because he's about to be 13, and I wanted him to have a role in this decision as well. And so we're really focusing on how to really structure his day, how to help him make and maintain meaningful connections with his friends despite the distance. And so it's really a challenge and a juggle and a struggle for us all.
Please, everyone, jump in.
So I'll jump in. I have two 13-year-olds and a 12-year-old, boy-girl twins. My third is a girl. So I have two going into 8th, one going into 7th. My son has dyslexia, so he goes to a private school that specializes in dyslexia. And I would say, just looking back to last spring, the private school did a much better job of structuring the day and doing remote learning than the public school did. My girls were very frustrated. They felt like they didn't really learn much the last 3 months of school. They felt like they were wasting a lot of time. So that was somewhat painful, I would say, just to see their, especially in light of my son kind of getting a lot of attention from his school. So when we think about the fall, I know my girls really want to go back. My son will go back at some capacity, whether it be virtual learning or in person. The school hasn't decided yet, but we're waiting on Baltimore County. I live in Towson, Maryland. So we're waiting on Baltimore County to make a decision on what they're going to do. They have not said yet what direction they're going to go. I know my girls in general, though, would like to go back to school or at least have a lot more structure in their day. So I think, there's a lot of unanswered questions from a school perspective, and we're waiting to see. But generally speaking, we're not really fearful. That being said, we don't want to be, put our kids at unnecessary risk, but we're just waiting to see what happens, and really not sure what the school district's going to do yet. So we're sitting back and waiting for now.
Millard and Megan?
Yeah, I'll jump in, Megan. For me, I have a different age group. Can you hear me okay?
Yep.
Saw your mouth moving there now. I think you went through this with your daughter and just finishing her senior year in high school. Mine is going into her senior year. And I think the difference is what Dr. Neal-Walden mentioned, I have a freshman in 8th grade when they tried the distance learning thing. It was very different from my high schooler. I mean, they had some class in the morning and then there was much independent study. And frankly, I don't think she saw the value in it. But my high schooler, she was on the grind from 9 to 2 to 3. And was able to continue on a different trajectory where they do a lot of more active learning, more independent study. The issue for her is going to be, she's been doing already some virtual college tours. It's not the optimal or the ideal scenario, but I'm hoping that things kind of go back to normal a little bit, because I don't know, like some of my colleagues mentioned, I don't know how I would feel about my daughter going away to college and having to deal with all of the ramifications of this COVID-19 virus, et cetera, in that person. The last thing I will mention is my wife. She works in education in middle school, and she's in the hot spot in Nashville, 37013. It's largely Hispanic, the community, and they are going to be struggling to do the distance learning. I think that the participation rate was around 10% at the end of the school year, but moving ahead, the new director of schools has vowed, and they're going to be issuing laptops to all students. But even with that, I think something about personal instruction and motivating them, because what I was able to appreciate is the differences in my then 8th grader and my junior, and that's the maturity level. And you need to be mature in order to really appreciate distance learning. So it's going to be an interesting school year.
Megan, before you go, thanks, Millard. I wanted to share my story. And to Millard's point, I have a daughter who just graduated high school and who has been accepted to college and has a scholarship and is anxious to go. And I'm very happy for her to go. And my wife and I are actually, the school is going to open, and we're pushing her. This is a good thing. And then there's that dad side. It's like, is this a good thing, right? Because anyone who's ever been to college knows there's no such thing as social distancing on a college campus, right? And so how do you manage the two as a parent and wanting her to go? The part of me is like, get out. It's time to go be a college student. Then there's that other dad side. It's like, COVID's big and it's real, and we know it's real. And as an African-American young lady, what does that look like? My daughter's super healthy. She doesn't have any healthcare challenges. And so I think she'll be fine. In the same breath, she has to come home, and my son has a slight touch of asthma, and my youngest, and he has allergies. It's more allergy related. So do I allow my daughter to come home, right? Or do we stick her in the basement for 2 weeks when she goes home from college? And to your point, Brandon and Tracy, and even you, Millard, I have a rising high school student who was going to play varsity basketball as a freshman, and now he's really hurt. Like, I want to play basketball, Dad, and he's a straight A student as well. And what does that mean? And so, every day my wife and I are having conversations with our kids every single day about, hey, here's what we know. We are intentional about taking them outside, especially me with the boys and playing sports. And my daughter is intentional every day about communicating with her friends. And I can tell you that it's been challenging. My daughter's cried a few times and said how it hurts, and she's stressed about it. And my youngest son, he doesn't care. He thinks it's the best thing ever. He's getting a little too much screen time on his iPad with Roblox. But I think this is a real conversation about mental health, even for the parents, because honestly, it stressed me out. So, Megan, I just wanted to share that as a parent.
As I mentioned earlier, kind of where we are in terms of our decision for going back to school. One thing I really worry about is, the ability for Danny, who will be a rising kindergartner, to continue therapy services. He's transitioning to the public school system from Easterseals, and we've been doing online therapy pretty much daily since March, and that's gone well with the therapists that he's had. Some of them since he was a baby, but transitioning then to the public school system and transitioning from an IFSP which is what they used for early intervention goals, to an IEP in public school, concerns me that he's going to and changing therapists, that there's not going to be that kind of baseline that we had with his current crop of therapists. So that concerns me, but trying to balance that then with his physical health. He's been in respiratory failure before. So how do we make the decision? And I'm just kind of waiting to see ultimately what DC schools decide, and we'll make the decision from there. In terms of this week we hired a part-time babysitter for the mornings, and had to have a very awkward conversation with her about social distancing and what her risk levels were. She told me she took care of her grandparents, so she took it very, very seriously. So I was thrilled to hear that. But my oldest said to me yesterday after her first day, he was like, God, I wish we did that before. And I realized, he was just really craving one-on-one undivided, or two-on-one, because she had Elliot, who is 2, and Danny, undivided attention, somebody who was devoted to them and to play, and who wasn't distracted on Slack or on Zoom while they were playing. And that made me really happy, and it also really broke my heart at the same time.
So thank you for that. And I can hear the challenge in your voice as a parent, like the last piece of that. And I tell my wife all the time, I've been intentional about stopping midday and checking on the kids and hugging them and making sure we go outside and do those things. Hey, we're midway through our conversation. We had a few questions. Please keep sending those questions. I know one was, the poll has ended. I'll be sharing those results with you here soon. One question was pointed at Dr. Neal-Walden. she'll go ahead and answer that question here. It's been, we pushed it out, but Doctor, if you could answer that, that would be great. We're going to take a little bit of a shift here, and I'm going to ask something that may be a little challenging, but I think it's a real question. Racial disparities in healthcare, both mental and physical. I'd like to start with Dr. Millard Collins, because again, you're on the front line seeing this from a Black community perspective. I'd like you to talk about what you're seeing from a healthcare disparity, both racial, as far as the actual physical facilities and what that looks like. Also talk about the culture of the community you're serving. Are they scared to go into the doctor in the first place, which is why we're getting some of this? And then Tracy, and then Brandon and Megan, please feel free to chime in about what you're seeing or feeling, because here's the truth. We're at a combustible place. We've got COVID-19, we've got Black Lives Matter, people are rioting all over the place. How is that, playing into the conversations you're having to have on a personal and professional level as well? So Millard, I'll start with you.
Great question, Darnell. And, there's no right or wrong answer for that. But I'm seeing the whole gamut. Some of the most common notions that we see is, many people of color are somewhat conspiracy theorists, and some don't think that it's real. Some think that it's very real, and we kind of go back and forth. For me, this is nothing different than what we've seen in all healthcare disparities, is that people of color tend to have worse outcomes. So for me, COVID-19, I guess on a very global, I can't even call it national, but a global scale, has pulled the scab off of this chronic wound that hopefully we will pay some serious attention to. What we've seen during COVID-19 in Nashville, Tennessee, just to put it in perspective, I know 2020 has been tough on a lot of people, but maybe 4 weeks before COVID really came on the scene, we had just had a tornado, and it affected large areas of North Nashville and displaced a lot of people. And what happened when you had people that were out of their homes? They were in these suboptimal living environments, trying to make it day to day just to have food and electricity and power and water. Then COVID-19 comes, and we tell them they have to go somewhere, but they have nowhere to go. Just imagine that challenge that we've had to deal with. But on a larger scale, many people of color, for a lot of different reasons, mainly access, distrust of the system. I mean, I can go on and on as to the reasons as to why our health outcomes are different. It's hard for them to lean on a system that they feel is compromised and not for them. Here at Meharry Medical College, largely what we do is we train people, primarily people of color, but we have a very diverse student population, to go back into underserved communities and do what they've seen here. For me personally, I'm a New Orleans, Louisiana native. I saw this in Katrina. When Katrina happened, part-time conspiracy theorists, but there's no way that the government could have made, a category 4, right? But the aftermath and the insolence in their response to give these people the assistance that they need, one has to wonder if it's a secondary condition, if our nation really cares about the vulnerable, the minorities, or the weak and the infirmed. And I think we're seeing a lot of that. But the good thing, I'm not going to just leave it with just the negative. The good thing that we see during times of this is, what humanity is really all about and when we've come together. The protests have been very diverse. They have been very, very instrumental. And I think some of the silence, and I don't want to call it ignorance because we all live in our own bubbles, but I think since some things have been brought to the front, I think the indifference has gone away. And I think some people are being very intentional about coming up with sustainable solutions, not just short-term and long-term. And I think we need to continue to keep that same energy so that the federal government will put out some of the same resources and grants, because we don't need health equality. We need equity. And that means some will need a little bit more than others to get them all to the same level. And then we're the greatest country in the world. It's time we act like it.
Awesome.
I'd like to chime in.
Please, Brandon, go ahead.
Yeah, with a thought. And that is, I think, well, first of all, everybody has a story. And I think it's important for us all to remember that. And I think right now, everybody's story is really close to the surface. And so no matter where you are in life or what you do in life, it's very important for us to put ourselves in others' shoes or have empathy for people, because you don't know what they're going through. You don't know their circumstances. You don't know their background. And so that's something that I've really been trying to do more of during this time, and talking to people about their concerns, and trying really not to judge them for wherever they are in that process. But, you know, I have some folks with young families that work for me. You know, they're stressed. They have really no time off. I mean, they're working, and then when they're not working, they're taking care of their kids, and their, you know, husbands and wives are flip-flopping, and just everybody has a different circumstance. And I just think it's so important for us all to remember that whether it be good, bad, or indifferent, but we all come from a certain perspective, and we all need to respect that and just enter in, rather than, you know, starting with facts or starting with, you know, even conspiracy theories, like Millard said. It's like some people do that, and that turns other people off, right? So it's like you have to really start by understanding where somebody's coming from, and just having some grace and empathy and patience. And it's not always easy, and conversations can be difficult, but I do think that this time, you know, in life, it's important for us to dialogue, and I do think it's interesting how a lot of these things are coming to the surface all at one time. So,
absolutely. Just a point of note, we have 18 minutes left. Please ask your questions now. We're going to talk about the poll results after Tracy and Megan get to chime in if they'd like to chime in on this topic.
Sure. Well, putting my journalist hat on for a moment, you know, as we mentioned, you know, conspiracy theories and misinformation coming to light, and people relying on that on Twitter feeds or on questionable news sources. You know, we as a news organization pride ourselves on being very bipartisan and quite wonky, to be perfectly honest. But I think that we feel an even greater sense of responsibility right now to get information out, to get the facts out, to triple check, and to just make sure that we are presenting information that the public needs at such an incredibly fraught time, both in terms of people's personal lives, but politically as well. So, you know, I love that information is so readily accessible in this age, but it frightens me where many people are getting their information, and how that is contributing to the ongoing pandemic.
Dr. Neal-Walden, we would love to hear from you here to kind of close this section out. The mental health in the healthcare disparities, not just from a racial perspective, but from a socioeconomic perspective. What are you seeing during this time?
Yes, so our clinic is low or no costs, and so we actually have seen an increase in the number of clients who come in, both with insurance and definitely those without. Because, you know, we've been talking about these conspiracy theories, but a lot of it has to do with anxiety that people have about the various unknowns. And I think people try and make sense of it. And then that's where the conspiracy theories come out, as well as just the difficulty in deciphering what's accurate in the media. And so what we focus on with our clients is really just helping them to deal with what's truly reality for them. And I say for them because it really varies from individual to individual, and helping them to learn ways to manage the various stressors that they're dealing with now. One of the questions that's on the Q&A actually has to deal with with some of the stressors that people are undergoing. And someone asked the question, many military spouses experience employment gaps due to frequent moves. What issues have you seen with military spouses as it relates to career, especially due to COVID-19? We've seen a lot of that, and actually not just the military spouses, but for many folks in the military, they were scheduled to move, and those moves have been delayed. And for some of their household goods have already been packed up and shipped. And so they're without their household goods and now uncertain as to when or where they'll actually move. And spouses may have, given up employment in preparation for the move. And so they have difficulties with that. Within our clinic, we also offer case management. And so we have our case manager work with those individuals, and we refer them to the Veteran Staffing Network to help them find employment while we help them with their mental health concerns. But it's a very real issue. And it's just one of the many issues that folks are dealing with right now.
Tracy, I appreciate that. Thank you. I'm sharing a personal story. A friend of mine, a very, very close friend of mine, is a military person that you just spoke about who was supposed to have moved 2 months ago. His move has been stopped, and is month by month. They were about to close on a home. They had to shutter that. He was managing a battalion, and now he's just kind of floating. The person that was in his spot actually is gone. And so he's trying to manage a team 3 states away, and they won't let him move. His kids are kind of in between where we're going to go to school. And so he and I talk, a couple times a week, and he just say stress is one of those things right now. He's extremely stressed, right? And so he's finding this thing to be like, is this time for me to get out of the military kind of conversation, right? He's been in 20 years, and it's like, maybe it's time. But at the same breath, he's like, what do I do next in my role? Because I hadn't prepared for that, because I thought I was going another 3 to 5 years. But if this keeps going on like it's going, my family can't withstand this kind of stagnation. So I'd love to share the panel results. Can we share those now? On the backside, can we share those, Christine and Kristen? So here's the answers. How do you manage stress? Can everyone see those? If you can, nod your head. You can see those. Exercise seems to be top of the food chain there. And to your point, who said that earlier? Brandon, you said folks are getting in better shape. And as a benefits person, that's probably a good thing for you when you're talking to companies, right? Do you feel currently managing your stress level well? It varies day to day. I guess that's a big topic. And Tracy and Millard, I'd lean on you to talk about that. During this pandemic, have you maintained a healthy work-life balance? Surprisingly, 64% say yes. And I'm happy to hear that. I'm really ecstatic to hear that, actually. And then, while working remotely, has your office maintained a sense of community and open dialogue, especially in regards to racial injustice? Not applicable is 19%. I think that's pretty high. No is 11, and 69% says yes. First of all, thank everyone for participating in the poll. I will ask my panelists, did you guys want to delve into any of these? You can unmute yourself if you want to talk about any of these specifically. Brandon, I'm going to push to you and ask you this question. Are you surprised at how many people are getting healthy? And does that change the way you have conversations with organizations about their benefits package and things like that?
Well, it is actually interesting because it seems somewhat high, but I think we have probably a lot of engaged people that are on the call. And when you have engaged people, they tend to take care of themselves. So I think that's probably an indication of the folks that have joined us today. But from a benefits perspective, it's very interesting because data analytics is playing a big part in how we manage our clients' benefit packages and their overall costs, because everybody is seeing healthcare costs rising for everyone at every level. And chronics, we call them chronics in our business. People with chronic conditions are the ones that tend to pop up later and cause large claims. So now those people with chronic conditions are very high risk for COVID. So we're talking to our clients specifically about that. Who are the folks that are high risk? Who are the people with pre-existing conditions? And how can we get them healthier? So I think that's a big conversation. It's always been a topic, but now with the direct impact of COVID and there's direct costs to employers as a result of COVID, their benefits, it's definitely a topic that we are discussing. So I love seeing that people are exercising. Before we got on the call today, I was saying how, people are either exercising or they're not, you know, and they're kind of going one way or the other, and not many people are staying the same. But I'm a big believer in exercise. You know, my son and I have been getting up and exercising. My girls have been exercising, so it's really cool to see from that perspective. And you know, I'll just leave with one last thought as far as exercise and taking care of yourself. You know, I always think about that airplane thought where they tell you to put your mask on first before you put your friend's mask on or your child's mask. And you know, I'm a big believer that if you don't take care of yourself, you really can't take care of anyone else. So it's really.
Did Brandon freeze on us? I think he froze on us.
Mannequin challenge. He's winning. He's killing me.
Anybody else want to jump in on that before I go to the next question?
Just briefly, just want to mention, you know, you mentioned about stress. Stress is fluid, you know, and I'm going to try to touch on the other question I was reading about immune system. You know, first of all, I'd like to thank Dr. Tracy Neal for her service, Neal-Walden. I liken the immune system to military fighters. Right? You don't just need any fighters. You need trained fighters that are specific to deal with this task at hand. And it means that when you're stressed, stress actually weakens your immune system. So managing your stress is very important to do that. So how do you deal with that? Stress, as we know, is fluid based upon if you're hungry. We've all seen the Snickers commercial, right? But also your sleep and everything else and your tools that you have available. It fits very well with what Brandon just mentioned. I think we need to maintain appropriate sleep. We need to maintain hydration. We need to exercise and get our bodies ready to fight this in the event that it invades us. You know, I don't want to make a pure left, right turn rather, and start talking about plant-based diets, but there's lots of good literature to talk about how plant-based diets actually give you a better and stronger immune system. So whatever individuals' needs are, I suggest that they actually get informed about what they can do to boost their own immunity, because it's not a magic pill. You have to do it all: sleep, diet, and exercise. And that's the best way to combat this disease.
Well, Dr. Collins, I appreciate that, because one of the questions that was just posed was specific about, and I was going to point you to that question, was asking you, should I be taking vitamin A? Should I be taking vitamin D? Should we be giving our kids these types of vitamins during this time? So we really quickly, we have 6 minutes left. What I'd like to do is first have you answer that, and then second, give every panelist an opportunity to leave a closing remark about how they feel about COVID, where they are mentally, stressed, and otherwise, and however, whatever remark they'd like to leave us with, either talking about their business and their brand and how someone can reach out to you directly to ask questions, or if you have other information you'd like to share.
Yes, quickly about vitamins. Believe it or not, contrary to popular opinion, much of the vitamins that we get externally through our nutrition. You know, so some people can take a multivitamin. I think that helps. But when we're looking to try to supplement with all these supplements, they get costly and it gets somewhat confusing. Occasionally, I get patients who come in all the time requesting B12 injections. We know B12 can help you. I make some of my providers actually draw levels, and I'm surprised to see that many people are actually outside the therapeutic range. A point is that sometimes vitamins can have a toxicity if they're taken in bulk. So stick to the script that's on the bottle, but if you have any questions, consult your personal attorney, right? Or your personal physician. I think having a conversation with the physician, I think, is the best way to go to claim your help. The last thing I like to mention, I turn over to my colleagues, is that, you know, we're all in this together. A lot of times we tend to look at the self, like Brandon mentioned. And as an alpha male, I welcome that challenge. If I don't work, if I don't do the things I need to, my family's life won't be what it's supposed to be. I welcome that. Not everyone can handle certain kinds of pressure, so you have to be honest with yourself. Reach out for help. You know, people of color, specifically, you know, the Dr. Tracy Neal on Walden's point, there's not many of her in my area, you know, and much of what I see in mental health is overshadowed by stigma and accessibility. And when you have people who don't understand certain cultural norms, for instance, I'm being silly, but not really, but some urban kids clap when they talk. That's just a part of who they are. I don't think that necessarily makes them manic. But I think we all need to be culturally competent, culturally aware. And what Brandon mentioned earlier, as we deal with all of this social issues that's adding to the pandemic, remember, we have 2 ears and 1 mouth. Let's listen twice as much as we speak. Thank you for having me here today. Thank you.
Thank you, Dr. Collins. Megan, let me turn this over to you because I want you to talk again from the parent perspective. Where are you feeling? And leave us with something that you'd love for all of the folks that are on to hear from your side.
I certainly feel the same anxiety that all parents are feeling right now, with the complicating factor of having a child with special needs and medical complexities. One thing that I try to do is to, well, aside from exercising and managing my own stress levels, but to not think out too far. Not wonder today what's going to happen in September or October. Plan to the extent that certainly you can. But think about this as a marathon, not as a sprint, and have patience. I think we all thought this would be over a lot faster than it is. And certainly back in March, I didn't expect the next school year to be impacted. We don't know when this is going to end, and we don't know what the fall is going to look like. So to just have patience with yourself, with your family, and just take care of yourselves.
Thank you, Megan. I'm going to go to Brandon, then Tracy. Hey, Millard, share your email address, if you will, out loud if folks are having a question. And then we've got 2 minutes left. Brandon, share your email address first, Millard, then Brandon, Tracy, then we're going to end with John.
Absolutely. I'm also going to put it in the chat and the questions. mcollins at mmc.edu. mcollins at mmc.edu. I'm going to answer some of the questions as we continue to close up.
Thank you. Go ahead, Brandon.
I would just say my closing thought is just an encouragement for everyone to press on, to be courageous. From my perspective, life doesn't end here on earth, and it's our fears drive us sometimes, and Millard spoke about this earlier, but be careful not to let your fears drive you. I think it's a dangerous place when you're driven by fear, and be educated, be smart, and be connected. If you're struggling with mental health issues, reach out to somebody, call a friend, talk to your spouse. There's people that are out there that can help, and you're never alone. I think that's probably the last thing that's important. You're not alone, and be courageous.
Hey, Brandon, because your organization does work and shares health benefits, go ahead and share where folks can find information about you.
Yeah, you can check us out at EONEbenefits.com. My email address is bluckett at EONEbenefits.com. And, if you're a business owner or you have questions about employee benefits, happy to help.
Megan, go ahead and share your email address before we get to Tracy. I know you're in the journalism space, so if folks are looking to write you and ask questions or send something, please.
Sure. My email is Scully, SCULL. Oh, I'll just put it in the chat. Sorry.
Share that with us here verbally as well. And then we got to go to Tracy.
mscully@cq.com, and my Twitter is at CQ Megan Scully.
Fantastic. Tracy, you are going to close us before John ends. First of all, let me thank everybody for being here. Mental health is vitally important. So is community engagement. There are disparities. To Brandon and Miller's point, we're working hard to fix those things. Keep pressing forward. Tracy, take us out.
Yes, so I think the other panelists really said much of what I would say. I would just add, don't be afraid to ask for help and to seek help. Most organizations have EAPs, or you can come to clinics such as ours, or contact your family practice provider. Most people who have mental health conditions seek help first from their family practice provider, and then they can help refer you on if you need additional help. But seek help, be flexible. be flexible in how you reach out to family members and stay connected, and take care of yourself. I added my email address. I'm also going to add my Twitter account too, because my email is actually going to change soon. And that's all I have.
Tracy's leaving us for a bigger, better job, but that's because she's so fantastic. Everybody keeps pulling on her. So, John, please take us out. Thank you so much. Thank you to all the panelists. John, your turn.
Well, thank you, Darnell, and thanks to all the panelists. This was really a fascinating conversation. And it, again, to me, reinforces the underpinning of living our core values every day in our lives. You know, think about what matters most to you and help make sure that that is underpinning how you react to the pandemic, both personally and professionally. As Dr. Collins shared, we're all in this together. And as we've heard from all of our panelists, we're not all in exactly the same situation. So this is a real chance to be sensitive to others in our communities. In closing, I want to thank you all for joining. We so appreciate your interest and your support of Easterseals, DC, Maryland, and Virginia. As you know, we're a nonprofit organization that depends on community support to deliver our programs. So if you'd like to donate, please visit donate.eseal.org. And thank you to Darnell and our wonderful panelists for sharing your wisdom with all of us today. And thank you to the Easterseals events team for arranging this great panel. Please enjoy the rest of your day. And if you have further questions, email us at info@eseal.org.
Now, before you guys go, let me say this. We have another panel coming up this month, July 28th. It's the American Disabilities Act. We're going to have our CEO from corporate. We're working on some other big panelists for you. We're going to do 2 of these a month. We'd love for you guys to continue to join us. And please share the word. Easterseals, DC, Maryland, Virginia. We're trying to engage our community one conversation at a time. Thanks a lot. Have a great day.